I welcome you all to today's session. Myself Rajita, and in this session, we are going to continue the discussion on the care of the old age people, and basically, we will be studying here regarding the special group of older adult population and regarding the gerontological nursing. So, let's get started with the special older adult population. Now, I hope in the previous session, we have discussed regarding the normal aging process. We have discussed regarding the demographic data of the old age in India. We have also seen certain factors which influence the aging process positively as well as negatively. In the next session, we have already discussed regarding each and every assessment findings or changes that is taking place in system wise in our older adult. So now we are going to see the particular population, or we can say a specific population, which basically considered to be more vulnerable in the old age group. So basically here we are going to discuss regarding a special older adult population. Now this particular groups are considered to be more vulnerable as they're having some different issues or some health issues and factors which are making them more prone to get illness and functional disability. So first, we are here going to discuss regarding the group of older adults who are consisting of chronic illness. So the incidence of chronic illness basically triples after the age of 45 years. So as the age increase, as the aging process is going on happening, we are going to see the disease progression is more likely to occur in individual. So it is considered after 45 years, there are more prone to get of chronic illness for every individual. So that is the reason why older adults who are under this age group are considered to be have a high risk for the development of chronic illness. Now, most of the people who are more than 65 years age have at least one chronic illness or a multiple illness also can be present. So majority of the cases we're going to see all the older adults at least will be present with one or more chronically illness. So this chronically illness is making this particular age group more vulnerable. So now we are going to read about the common chronic problems or chronic illness which are often seen among the old age population. So the most common disease condition or illness or chronic illness which are being noted among the old age population is hypertension. So as we know, the hypertension is very common because as we have learned in the changes in the physiology that there will be thickening of the arterial wall, even stiffening of the media and intima can also lead to increased systolic blood pressure. And ultimately, this process, which is occurring with increased age, ultimately causing a increased blood pressure. The next one is osteoarthritis. Majority of the population of old age will be complaining regarding the development of osteoarthritis as an aging process. The next common chronic illness is heart disease. So as we are seeing that there is increased chances of hypertension, definitely this factor itself is leading to increased risk factor for the development of heart disease. Even you have to note it down that with the ages there will be inflammation or there will be proliferation of the myocardium layer of the heart, and ultimately this is causing decreased cardiac reserve and cardiac functional ability. That is the reason why we are going to see with increased age, heart disease is a very common chronic illness that can be affect the older population. The next condition is cancer or certain type of carcinoma. This also is very common with the ages as it is increasing the exposure to the certain chemical factors which is ultimately increasing the risk of the development of carcinoma. Even genetic factors and family history or familial history, basically the positive family history, plays here a very important role to identify whether a older adult is having more likely to develop with carcinoma or not. The next common condition is diabetes mellitus. So we have already learned in the physiological changes that with the ages there will be fibrotic and changes in the size of the pancreas. So definitely we are going to see the insulin activity and the tolerance of glucose here is getting disturbed in the body of an older individual. That is the reason most of the cases we are going to see the development of diabetes mellitus for every individual who are crossing the age of 65. The next condition is related to the neurological system, that is the Alzheimer's disease. Now, as we have learned that definitely with the aging process, there will be changes into the circulation or cerebrovascular circulation even. Even brain tissue degeneration is very common among the older population. That is the reason majority of the cases we are going to see with old age, this nervous system related or this disorders related to the central nervous system are very common. One among them is Alzheimer's disease. The next one is dementia. Dementia is also very prevalent among this age group. The next condition is vision and hearing impairment. Already we have learned that obviously there will be sudden changes into the visual acuity and visual field. Even hearing also will be getting disturbed because of the impaction of segments as well as because of the degeneration of the nerves and inner ear and middle ear structures. So that is when we are going to see with the aging, a person is more likely to suffering from mild to moderate and moderate to severe visual and hearing impairment. Osteoporosis is a very common clinical condition, or we can say a chronic illness that will be taking place in the older adult population. As we have learned in the physiological changes that as there will be disturbance or increased parathyroid hormone, which is ultimately increasing the reabsorption of the calcium from the bone. Now, as you're understanding the absorption and reabsorption, if this mechanism is getting altered or disbalanced, if the reabsorption of a calcium is more into the circulation, we're going to see the bone density will be getting decreased. And that is when an older adult is more likely to develop with osteoporosis. So it is also considered as a very common chronic illness among the older adult population. Associated with osteoporosis, we often going to see a client with old age are more likely to suffer from hip fracture. So as you are understanding that we have already learned that their body balance will be, even the gait will be getting disturbed with the aging process, as well as their bones are not heavily mineralized, or we can say the density of the bone is more likely to decrease with aging process. That is the reason why hip fracture or fracture associated with bone is very common among the older adults. The next condition is stroke. So many of the cases we are going to see the stroke will be causing a complete impairment in the functional ability of the individual in this age group. The next one is definitely depression. So depression is a very common clinical condition among this age group, because you need to understand first of all the person here will be losing their functional ability. Some or the other way they will be getting dependent on their family members or on their spouses or on their children, as well as economically also, most of the old age population will be depending on their family member. So that is the reason, due to the psychological state, due to the dependency, and due to certain cases where the family members are showing more negligence towards the older adult group, we are going to see most of them will be more likely to suffer from depression. The next condition is Parkinson disease. So, Parkinson disease is also a very common neurological problem seen among the older population. So, till here, I guess we have learned regarding the common chronic illness that will be seen among the client with old age. Now, we are going to talk about the next group of special or specialized older adult population. Now, this indicates the group of older adult women. Now, many factors have significantly have a negative impact on the health of the older woman. In India, in the previous generations, majority of the cases we have been seeing the woman will be mostly dependent on their spouses for the income and for their economical resources. We are often going to see that majority of the cases now the older adult woman will be living in the poverty due to the dependency or due to the economical dependency on their family members. Lack of formal work experience also, which will be leading to a lower income for the older adult woman. Majority of the cases we're going to see the woman will be more likely to suffer from many psychological conditions, mainly depressions, as well as many conditions like dementia, as well as Alzheimer diseases and Parkinson diseases. Now, also, they are having higher chances of the development of problems like arthritis, hypertension, stroke, and diabetes. So, you need to understand with the aging process, they will be stopping with their menstruation cycle, and also they will be having a severe changes after the menstruation period is getting stopped or after the menopause. This hormonal imbalance will be ultimately can affect the woman in a very negative way. So, we are going to consider that the older adult woman will be having a higher risk than an older man to develop certain disease conditions which are chronic, like diabetes mellitus, arthritis, osteoporosis, hypertension, and cardiovascular disease. Even stroke is very prevalent among the women. Majority of the women also will be suffering from different or a variety kind of disorders related to their parity. So in case of multiple parity or multiple para woman, we are going to see the woman will be more likely to have the disorders related to their genitourinary system. That is how the older adult women are considered to be a special group among the old age population. The next important or point or the specific group of older adult is the cognitively impaired older adults. Now, we are going to often see older adults may experience memory loss begin with a forgetfulness initially, which is significantly will be affecting or which will be significantly different from the cognitive impairment. Now, this is also referred to age associated memory impairment initially. So it is very common among the older population that with the increased age, their memory loss will be getting very commonly featured. Now, next here, the surroundings and the social support plays a very important role to encourage the older adults with the memory improvement techniques. Certain memory aids, even memory improvement techniques, should be demonstrated within the community area in order to decrease the impairment of the memory for our older adult. But This particular group of people of old age who are cognitively impaired or having memory impairment with the association of age is considered to be a very specialized group among the older population. The declining of the physical health is also important factor for which will be ultimately affecting negatively the cognitive functional ability of the particular individual. Now, older adults who experience sensory loss, heart failure, certain cerebrovascular disease may likely to suffer from cognitive dysfunction. So, both the cases of age associated memory loss and a direct cognitive dysfunction can alter the quality of life of our older adult. That is the reason special care should be provided to those older adults who are cognitively impaired. Next, we're going to talk about the fourth specialized or specified group of older adults that considered the older adults who resides in the rural area. Now, basically, we are going to see they are more likely to suffer from health problems. They basically have five barriers which will be ultimately negatively affecting their health in the old age. It includes first the transportation and communication. Majority of the older clients who are residing in a rural area, we are going to see those people or that particular population will be having higher chances to have lack of knowledge related to the preventive health and lack of transportation, which will be ultimately causing a difficulty to seek for medical care, at least in a preventive and promotive health care. So that is the reason in rural area, the older adults will be considered as a very specialized group. The next factor is limited supply of healthcare essentials and deficiency in the healthcare providers into the rural area. So initially we have been seen that community area will not be having a proper medical care and medical devices to perform certain procedures or to provide adequate medical care to those older clients. That is the reason this is considered to be the second factor which increase the chances of development of disease condition and complication among the older population residing in the rural area. The third factors includes lack of quality health care. So majority of the cases we're going to see in the rural area, the quality health care will not be sufficiently provided to all of them. First of all, there will be lack of healthcare workers. Second of all, there will be lack of economical resources. That is the reason we are going to see even the lack of knowledge into the rural area and the people over there will be causing lack of quality healthcare. The next condition is social isolation due to decreased communication with the other part. Financial limitations is also a very common factor which will be causing or which will be basically taking the rural older adults to be in a specific and very specialized group. The next one is the chances of more likely to engage into the health promoting activities by the rural older population is not likely to be very good. So we are often going to see in rural areas older adults will not be following any preventive and promotive healthcare activities due to lack of knowledge, lack of interest, and lack of information. So that is how these factors are making the rural older adults as a specialized group. The next we're going to see the homeless older adults are also considered to be one of the most specialized group in the older population. So the key factor associated with the homelessness is first having a very low income. Definitely, a homelessness is suggesting that the client is not economically stable. Second, they will be having reduced cognitive capacity, and they will be more likely to stay or to present in a stressful environment. Living alone is a very common feature among them. Living in a community which is not affordable for the housing is also provide them a stress and psychological burden. Now, it's can be due to crisis or some economical disability, which will be ultimately causing a development of chronic illness among the older adults who are homeless. Also, they will be suffering, or most of them will be living in a very unhygienic condition. So, that will be ultimately increasing the chances of the development of infection or infectious disease among the older adults who are homeless. So, that's how this particular group also would be considered as a very specialized group among the older population. Now, this population or this old age who are homeless are also will be having decreased necessity or the decreased supply of the necessary elements like their dietary intake, their medications, or their medical care. Even shelter and meal will not be sufficient enough. So that is the reason why taking care of this specialized group need a multidisciplinary approach which links the old age shelters with the outreach, even with the primary care clinics. So, frail older adults basically we consider frailty as a geriatric syndrome in which three or more than the following conditions will be present for an individual. First, the frailty includes the advanced age. At least the age group which are more than 75 is considered as advanced aged. The next one is unplanned weight loss for an individual. So majority of the client due to lack of physical activity in case of old age people we will be seeing there can be development of obesity. The next one is weakness. So it is a very common feature due to the lack of muscular and nervous system activity. We are going to see the weakness is a very common feature among them. Poor endurance and energy conservance also is a feature which is suggesting the frailty. The next one is slowness or slow reaction time. The next one is low activity level. This all are factors considered to be assess the frail older individual. Next, we're going to see the risk factors which are associated with this particular age, older age group is the presence of disability, multiple chronic illnesses, which will be definitely affecting the quality of life. The next one is the dementia. So these three factors are very common risk factors to diagnose or to conclude that the particular old age individual can come under the specialized group of frail older population. So it is considered the people who are more likely to come under this specialized group is definitely having a history of smoking or a continuation of the habit of smoking, a history of depression or any long term psychological conditions also increase the risk of an individual to come under this specialized frail older adult group. The next condition is definitely a long term medical health problems and a proper or improper weight management. This also includes a high risk for the development of an individual, a chronic diseases, which ultimately will be leading to the individual to come under the frail older age group. So basically, the old population, which we have seen before, that the people or the individual who are having more than 85 years old are having the most risk or increased risk for the frailty. Although many in the age group will remain healthy if they're maintaining the preventive and promotive health activities before. So often we're going to see this Frail older adults will be tired or will be complaining about their tiredness easily. They will be having little physical reserves. They will be having very high risk for development of disability. Elder mistreatment is a very common feature towards the frail older adults. Disturbance in the sensory pattern will also be noted here. There will be definitely presence of physical and mental fatigue among the client. There will be presence of limited mobility. The prevention of fall should be ensured because these clients will be having high risk for fall. As I have mentioned, they will be definitely having increased chances of malnutrition. That is the reason the dietary intake should be proper and balanced, and that has to be ensured by a medical professional. And also, maintenance of the fluid electrolyte balance and decreasing the chances of the infectious process to develop also should be ensured while taking care of a frail older adult. Monitoring has to be done for their vital signs, their hemodynamic stabilities if indicated, calorie intake, protein, iron, calcium, vitamin D supplementation intake, their hygiene maintenance, and we should assist them to perform their activity of daily living to increase their self image. So, as we have learned the basic concept regarding the frail older adults, why they will be considered as a very specialized group among the older adults, next, definitely, we are going to learn here the common type of older mistreatments. It first includes the physical abuse, which are very commonly seen among the older adults who are staying with their family or maybe who are undergoing or undergone institutionalization related to a prolonged medical care or related to the seeking a prolonged medical care. The second most important or common mistreatment for the older adults is the neglect. So, as their functional ability and physical and psychological ability will be reduced here, often we are going to see the older individual will be a victim of neglect, even by their family members as well as the medical care professionals. They will be always considered that as a burden, as they will be mostly economically dependent on their family members. That is the reason the second major and common mistreatment which will be often seen among the older adults is the neglect. The third most common thing which are being seen is the psychological abuse. So, as they will be emotionally and psychologically weak, it is very common feature that they will be getting psychologically abused. Sexual abuse also is a very common feature of the mistreatment among the older adults. The next one is financial abuse. So financial abuse will be majoritarily done by their family members or maybe in the institutionalization or in the institution where they are staying for a prolonged time. The next is violation of personal rights is a very common mistreatment which is being seen among the older adults. The next one is abandonment. So as they are not physically or psychologically strong, abandonment is a very commonly seen mistreatment towards the client. So, as we have learned regarding the specialized older adults group and their problems, now we will be learning about a technique through which these problems can be solved for the older adults. Now, you have to recognize as a aging process or as a result of aging process, naturally the older adults will be having increased physical, psychological and emotional need and support. Social support here plays a very important role to maintain the psychological and physical activity maintained in a normal level among the older adults. Here, we are going to read about social support and different phases and level of it. So basically, the social support for the older adults will be categorized under three levels. The first level will be containing the family members who are considered to be the primary and preferred care provider in order to support the older adults. The second level basically includes a semi formal level of support, which is found in the clubs, religious places, in the neighborhoods, and for senior citizen center. Now, here, the semi formal groups will be consisting of the older adults and their friends so that a proper emotional and psychological, even physical care can be provided to them. So the third level consists of the formal systems of the social welfare agencies, health facilities, and government support, where they will be completely formally providing emotional, healthcare, and psychological support to the older population. Social services also plays a very important role to maintain the quality of life of older population. Basically, the social service, it is a network of social services supports which older adults both or which provides the supports of the older adults both in the community setup as well as in the healthcare facilities. Generally, the national policy on older people will be followed here to ensure a holistic well-being of the elderly people or elderly population. So appreciation should be provided to the special needs of the elderly, and which will be emphasize on the empowerment of the older population into the community as well as individual to the safeguard their right and their need. It includes the financial security, it includes providing a health security, legal and social security, as well as psychological security towards the older population. Now, there are presence of care alternatives for older adults. Older adult with special care need include the people who are homeless, who need assistance with their activity of daily living, who are cognitively impaired, or the people who are homebound or longer able to live at home. Here, basically, older adults may be served by adult day care, where only the client will be present for a certain duration of the day and they will be assisted with the performing with their activity of daily living. The next is adult day health care, where the procedures and necessary medical care would be provided to the older adult. The next is home health care, where basically a professional will be performing all or will be providing all the health needs into the doorstep. And the next one is long term care or rehabilitative care, where basically the older adults will be kept for a prolonged time for providing them assistance in order to maintain a normal, healthy well-being. So, as we have seen, the three major part where which is basically known as social support, social services, and the care alternatives. Through these methods, we are going to see in a society the older adult population will be provided with effective care in order to maintain a good and healthy lifestyle and also to improve their quality of life. Next, here we're going to learn about the gerontological nursing. So, as I have mentioned, it is a specialized nursing care which will be definitely provided or include the older adults. This particular gerontological nursing is considered one of the most important specialization which practice a specialty of knowledge of body within the nursing basically involves the providing of the care towards the older adults and the frail older adults population. This specialty of nursing approaches to the older adult with or as a whole person. They look for their physical, psychological, developmental, socio-economic, cultural perspective and need. Now, in older adult, cascade of disease process can occur. So nurses here should be very vigilant enough to identify the early signs and symptoms that may be present and indicating the development of disease and complication. So comprehensive geriatric assessment should be interdisciplinary, and we are going to see the components of gerontological assessment now. It includes a detailed medical history, a physical examination, functional assessment, medication chart review, cognitive and mood evaluation, as well as available social resources and the need of the client. Once the assessment is completed, the interdisciplinary team will be meeting the need of the client, and as well as they will be meeting personally and physically with the older people and their family member to present or to explain their need. Basically, they will be recommending the family member regarding the physical assessment findings, the mood assessment findings, findings of assessment of activity of daily living, the mental status evaluation, as well as the social environmental assessment findings. So we are going to see definitely a thorough medical history collection, and a physical examination plays here a very important role for a gerontological nurse in order to note down all the necessary findings and need of the client, which will be able to described or discussed with the family member and the care provider to the frail older people or a older population or an individual who is a victim of a aging process. Generally, the gerontological nursing, the planning here includes the priority goals of it includes the gaining the sense of control and gaining or improving the self-esteem for the older adult. Next is feeling of safety should be improved here from the client, as well as reduction of stress also would be ensured in the planning of the goal by a gerontology nurse. Also, we're going to see the nurses here will be having a plan to meet all the necessary goal of an individual by assisting them in performing activity of daily living. Maintenance of proper food intake and dietary intake, as well as fluid balance, would be ensured by a nurse. Maintenance of hygiene also will be ensured by them. Definitely, while implementing the interventions, we are going to see a nurse should maintain a proper approach, or they should modify the approach depending on the client's physical and mental need. A slow approach, adaptive equipments and plan, a calm and quiet environment and approach, a detailed explanation of every procedure and disease process or treatment plan should be done by a nurse in order to promote the effectivity of the management towards our older adult. Health promotion and preventive care should be ensured by the nurse, which includes increase the self-care ability and knowledge regarding the self-care and hygiene practice. The next includes improve the personal knowledge and regarding the personal responsibility of their own health. Next one is independent functional ability should be increased by a nurse for the older adults within a limit. Definitely, there should be a detailed teaching of the client regarding the aging process, regarding their activity or their role to manage the condition of them. Also, there should be a teaching will be done for the client so that they can modify their self expectations within the limit. Also, education should be provided regarding the treatment plan, the essentiality of the medications that has been given, and ensuring the adherence to the medical regimen. Also, it is a nurse's role to teach the gerontological client regarding the use and the available resources and its essentiality to use it. Now, in acute care setup, we are definitely gonna see a nurse would be performing a very vital role here. They will definitely perform a thorough assessment and physical examination. Monitoring should be done in a continuous approach and at a regular interval. Consideration should be provided to the discharge early from the hospital care to the proper setup or home care setup with a proper education of the activity of daily living and needed assistance, the medications regimen, and the hygiene practice towards the client as well as mainly to the family care provider. So, our gerontological nurse here should be implementing all the standard protocol to screen the high risk older adults. Even they should follow all the policies and protocols while providing care to this vulnerable group. Implementation of mobility programs will be done for the clients who are not comes under the frail older group to prevent the functional disabilities to occur. Nurses here plays a role of advocate in order to support the need of the older people with the other healthcare team professionals. Care transition is a very important part here. So as we have seen, the client can be have different care transitions or different level of care. So as a nurse, we should shift the client to the different care transitional level depending on their physiological and psychological need. Rehabilitation should be ensured. So basically here the goal is to help the older adult to recover early and adopt with the disability that is a result of the aging process. So this may occur with the acute inpatient rehabilitation or in a long-term care setup. So that this rehabilitation definitely need a proper training, assistive equipment, and a huge knowledge regarding the aging process and their disability and the adaptive methods, as well as also the attendance to or attendant personal care ability. The people who needs the rehabilitation care often includes or often the people who are suffering from a chronic illness, such as the people who are having history of stroke, arthritis, or heart disease. Now, this also includes certain disorders which increase the disability of the older clients. Through rehabilitation, this disabled clients or disabled older clients will be definitely able to maintain their quality of life adequately. So first preferences will be given to those clients with pre-existing problems associated with reaction time, visual acuity, fine motor ability, physical strength, cognitive dysfunction, and who are having problem related to a chronic illness. So these are all having the first priority towards the rehabilitation. So once the clients are admitted to or taken to the rehabilitation center, here the medical professionals will be performing different methods in order to maintain their quality of life. Deconditioning here is a very common because almost majority of the adults will be physically inactive due to their surroundings. So here we are going to assist the clients to perform their activity of daily living within a particular range where they are comfortable. Passive and active range of motion exercise will be suggested for the client here with the prevention of other disease conditions. So basically, the passive and active exercise will definitely helps a client to decrease or reduce many other disease progression and development. It also improves the functional ability of our older client. The next is the goal of the rehabilitation is to strive the maximum function of physical capabilities considering the individual's current health status as well as to improve their psychological capacity depending on the client's suffering and disease condition. Assistive devices which are often used for the client includes the dentures, glasses, hearing aids, walkers, wheelchairs, certain adaptive utensils, elevated toilet seat, as well as certain skin protective device. Being a medical professional, basically as a gerontological nurse, we should have a huge knowledge regarding the usage, the care, and the applications of all these devices for the older client. Safety also would be ensured by a gerontological nurse. Basically, the people or the older adults who are having high risk for them, the safety would be ensured by them. People who have normal sensory changes or a slowed reaction time, decreased thermal and pain sensitivity, changes in their gait and balance of the body should be given a first priority while talking about safety of the older individual. Next comes the people who are cognitively impaired. Psychological safety should be ensured by a nurse or a medical professionals who are dealing with the older adults. Medication usage are very common for the older adults to manage their signs and symptoms. That is the reason a thorough and regular assessment would be done. A proper care plan should be formed, and the evaluation of the medication's effect should be done at a regular interval by a gerontological nurse. Adherence to the medical regimen should be taught to the client as well as their caregiver or family member. Treatment of depression and psychological disorder should be ensured, because majority of the cases we are going to see the older clients will not be recognized for their psychological disturbances or depression. That is the reason it is very important for a gerontological nurse to understand the need of the client for a psychological support, and we are the one who will be assuring that we will be providing adequate psychological supports towards the client, as well as we are helping the client to consult a psychiatrist or a counseling even if there is any need. Use of restraints will be done for certain cases with older individuals who are hyperactive. Physical and chemical restraints will be used. Now, definitely, the legal procedure of the usage of restraint, the taking the consent from the family members or from the patient or from the older adults, as well as application and care of the restraints should be ensured by a nurse. Restraint should be therapeutically used. It should not be misused, and it should not harm the patient physically and psychologically. Nutritional need is a very important part while taking care of an older individual. As we have said, the anorexia is a very common feature, characteristics among the older adult. That is the reason a proper nutritional supplementation, providing less but frequent meal, soft meal should be ensured by a nurse. Also, maintaining the adequate hydration level among the client or among the older population should be ensured by a nurse. Rest, sleep, activity should be paced by a nurse accordingly or according to the patient physiological and psychological condition. So a complete bed rest will be suggested if a client is having severe disorder which is causing increased risk of fall and injury. Otherwise, assisted activity of daily living performance would be suggested to the older clients. Even often, a nurse should encourage the client to perform their activity of daily living on their own. Maintenance of the hygiene and reduction of the chances of infectious process to develop is also a very important part of a nursing care towards the older population. So I hope here you completely got the concept regarding the care to the older population which a nurse should perform, as well as we have seen throughout the session related to the aging process, the demography of the older age population in India, as well as different factors which is affect the aging process. We have also learned different level of care towards the older adults, and we have learned the basic physiological changes which are going to find out in among the older population. Even we have seen the specialized group of older adults and their care. So I hope now you have a complete concept of the gerontological nursing as well as the aging process and age related problems. I hope you have enjoyed the session. Thank you so much for attending this one. We'll meet you guys in the next one.